$360,200 to the police budget. I've suggested we take this year's 5% from police recruit classes, Kentucky Derby Festival events, and completely divesting from military-style weapons, ammunition, and law enforcement equipment. But there are other options, of course. Overtime instead of one or two of the recruit classes, for example. Similarly, I have suggested how to spend the 5% instead. Increase community health and social service staffing by 50 workers, double the general fund appropriation for the Office for Safe and Healthy Neighborhoods, reinstate and double the small business development team we cut last year, earmark $1 million for participatory budgeting to reinvest in Black communities, and fully fund seasonal pool operations. I understand there's an amendment to support the Louisville Community Grocery, which I applaud, so I would send the rest of the money to Jobs for Opportunity Youth. Again, there is no perfect answer, but this math works. One other item. Last year, this council also cut $425,000 from the capital budget that was earmarked for Jefferson Re-Squared, a beautiful plan to renovate Jefferson Square into the city's premier public plaza. Instead of restoring that funding, which could be used to properly honor both Breonna Taylor and the fallen public servants traditionally recognized in the square, the current budget proposes to spend the near identical amount, $435,000, to demolish the historic old Odd Fellows building, owned by the Omni Hotel and subsidized to the tune of $139 million, way prematurely under local law and according to the development agreement. One day, Metro may be obligated to demolish the building, quote, within a reasonable time following notification from Omni that Omni intends to proceed with the development of the parcel, close quote. But at this time, the hotel giant has no concrete redevelopment plans whatsoever, and the building will still be tied up in administrative and court hearings 365 days from now. The Omni can wait. Honoring the citizens and the sacred public space at the center of this historic moment in our community cannot. I'm asking you to make that switch in your amendment. The last 100 days have been unlike anything in our lifetimes in terms of office. The doors to City Hall have been closed, our chambers have been empty, the demonstrations, emails, and phone calls have been disorienting. But we are hearing from the public louder than ever before. We are seeing the problem with our own eyes and in real time, and we are feeling the consequences, all of us. Now, either this body is going to make the next 100 days the beginning of the more peaceful and just society and city of Louisville that we all want, or else 26 other women and men are going to do it for us one day after the people literally vote tomorrow and in the fall and again in 2022. I say let it be us now. Thank you very much.
Councilman Ackerson.
Thank you, Mr. Chair. I had a question regarding two things, actually. One is we had a item pertaining to moving some funds around for Blevins Gap Road, $93,000 that was left over from pools. Is that going to go away now based upon what we're allocating for Blevins Gap Road in this present budget, or are we still talking about allocating that pool money over there?
Councilwoman Fowler, that has not moved forward. Councilwoman Fowler, do you want to respond to that?
It's still tabled, Brent.
Yeah, but is that that $93,000 going to be in addition to the $100,000 you said you need today? Are you?
Nope.
So today's allocation that you're spending would sort of negate and becomes mute the pending legislation pertaining to that $93,000 of pool money, correct?
Not necessarily, but I'm just going to leave it tabled. We'll talk about it later, I guess.
Okay. Mr. Chair, my second question pertains to the $3.5 million to subsidize the grocery store. Is there any language in the budget that designates the spot, or are we just saying we're going to park $3.5 million in trust administration, or is there language that requires it to come back to us for approval of the location?
There is not, and there is no location selected. So when this was discussed at the hearings that we had, there was discussion about the Louisville Community Grocery, which could be one of the options for the grocery store, that they had looked at several locations. We asked that question. They had not selected a location. It also could be, there may be an RFP sort of process for how this money is spent. But no, there is no location designated in the budget.
Gotcha. I mean, something that I don't know if there's any will of the body to consider, including community activist groups that deal with the food deserts and food inequities, taking part in helping to select the location. That's something that I don't have the language here in front of me now, but if possible, we're going to work on an amendment for Thursday night pertaining to that. So I just want to give you a heads up on that.
So again, and that's fine. Of course, my strong feeling, I'm virtually certain of this, is that the Department of Health and Wellness, where this money is parked, would have that kind of community engagement as part of their normal process. But that's fine. If you want to make an amendment, that's fine.
Great. Thank you.
President James.
Thank you, Mr. Chair. Mr. Chair, I'm not on this committee, but I've received a phone call from another council member just prior to this meeting, and the solid waste management advised that they don't have any functioning alley cameras currently to capture people that are putting trash in the alleys. The cost to get the required number of cameras and to get the ones we have repaired would be $50,000, and I'm asking if somebody on the committee would be willing to make a motion and have a second to add to the bond by $50,000 so that we can purchase the required number of cameras or get the ones that we have fixed.
So moved, Winkler.
Second, Dorsey.
Okay, so that's properly moved and seconded as an amendment to the amendment. All in favor of that, let's say. This is just the amendment to the amendment. Say aye.
Aye.
Opposed? All right, we will make that change. Mr. Stenberg, I assume you could make that change?
Yes, I can.
Councilman Kramer?
Thank you, Mr. Chair. For the rest of the folks on the committee and for the viewing public, please be aware that there had been quite a bit of conversation about the alley cleanup and these cameras. It came to us just today that the mechanism whereby we thought we would be able to take care of the cameras wouldn't work. That's the reason for David's bringing it at such a late stage in the game. I know all of us have tried really hard to get this button down before the meeting started today, and it's just unfortunate. This is the reality that one showed up that way. So I too voted yes, like the rest of us. But I just want to make sure we understood that this was a somewhat exceptional situation, and it has been in the conversation. It's not like it just came up out of the blue. Thank you, Mr. Chair.
Councilman Fox.
Thank you, Mr. Chair. I'm not on this committee either, and I won't get a vote, and I won't be able to forward any amendments, but I do want to speak to our colleague's amendment and say straight up, I support no defunding of the LMPD at all, and I will explain why. Before COVID and before the recent voices we've heard in our square and on our streets, we were talking about the drain that our LMPD was going through. We were losing the best and the brightest men and women from that police department because the pay had dropped to a substandard level, and the benefits had come to a point where these men and women couldn't afford to feed their families and still work there. So they're leaving, going to other police departments. What was scary to me was not only the amount of people leaving, but the lack of people interested to come in. It's a very difficult job, as we've seen illustrated over the last couple of weeks. And my colleague mentioned that law enforcement is changing. It is a fact. Well, I won't discredit where he gets his facts, but the folks that dial 911 and need police officers to respond, they may not have read his new fact. The 56 victims of homicide in this community may not have read that fact. Shootings are up over 89% so far this year, and as of this morning, shootings that did not involve a fatality was at 219. Just think about that. Community of about 800,000 people. We have 219 shootings. We have 56 homicides. I think that illustrates the need for law enforcement officers, and I'm listening to my citizens as well. Pardon me. My citizens want to see more police in their community, and they want to see them actively engaged in stopping crime in matters of disorder. So I just wanted to state publicly my opposition to defunding an agency that is already defunded, already demoralized, and already at a low point. We need to do all we can do to get them to a high point where professional young men and women are attracted to that profession, and they can serve this community at the level that this community expects, because there's a lot of great folks there doing great work every day. And if we continue to let funding go in a downward trajectory, we're going to be left with an agency that employs folks that we may not want to have. So again, I'll be voting against any measure that involves any defunding from a department that I contend is already severely defunded. Thank you, Mr. Chairman.
Councilman Mulvihill.
Thank you, Mr. Chair. I appreciate all the work that's been done on the budget thus far. I know it's never an easy task to try to make decisions, but I did have to speak to one that I'm pleased to see. I think it's a really good first step. As a former prosecutor, we talked about for years,
1 week from today, bars, venues, including wedding venues, even Kentucky Kingdom, an amusement park here in Kentucky, will be open at some capacity. Now, it has already been a long road in dealing with this virus, and we know that there are many days ahead. But to go from a time when our cases were doubling every week, when our healthcare capacity was threatened, where we had almost zero testing, to where we are today, far exceeding our testing thresholds, and as you will hear our numbers today, having a pretty good week in maintaining and controlling this virus. We have come very far, which is allowing us to do more and more in our economy. But please remember that given that we are seeing spikes in many states that opened much faster than we did, our ability to do all of this, to see each other. Next Monday, it's groups of 50 or less. All those days when we were just healthy at home, trying not to go anywhere, think about it, groups of 50 or less. All that's dependent on whether we can adapt, on whether we can do what it takes moving forward, or do we just fall into old patterns. So remember, we used to say, hands, wash them, face, wear the mask, and space, stay 6 feet apart. If we're all willing to continue to do that, we can continue on this really positive trajectory where, if you saw the drop in the unemployment rate in just this last month, means that we can reopen our economy faster, we can move forward, and we can be healthy as we do it. Wednesday, the next time we come to you live from here, we're going to outline our plan to reopen schools. It's a comprehensive plan where there are some expectations and some very strong suggestions. And we are going to have that guidance, and it's a public health document. Some things schools will be able to do easily, some things will be harder, but from a public health standpoint, it's important that we put out there what the very safest practices and procedures are. I know it's been a long time coming, but it's coming out about the same time as other states, and there has been more back and forth dialogue in this one than maybe in just about any other area. I've always told you I have two priorities. Number one, reopening our economy safely, and number two, getting our kids back in school, in person, in the classroom, but also safely. And we've seen some news out there, mainly from college athletes coming back on campus, that shows that it's really easy to bring people back. But in keeping them COVID-free and keeping them safe is going to require us doing things differently, to innovate and to make sure that we are protecting our young ones. So I think as we move forward, then Dr. Stack is going to talk about different guidance that's going up today. I want you to really think about a rule of 50%. 50% of what you would normally have done is what you ought to be doing on any given day. If you would have gone to lunch and gone to dinner, just do one. If you would have gone to a certain number of meetings with others out there, cut them in half. It's just like most venues, most areas, like restaurants here are about to reach 50% capacity. Let's think about that as a lifestyle as we move towards getting a vaccine for COVID. If we can do that, and this comes directly from the president's doctors, I feel like we will be in the right place to make sure we can continue our reopening without seeing what we have seen from some other states. And I think today's numbers are an example of that. First, as an update from Sunday, we had to revise that to add 3 additional cases that came in that had not been counted. So Sunday's number wasn't 117, it was 120. And that's a pretty good number. When we look at, well, 120 is way too many cases of COVID because we don't want any cases of COVID, but it is much better than what we had seen, especially a full week before. And today continues reports that are lower than when we saw those 250, 350 reports. Today, and again, it's part of the number of labs that come in, is one of the lowest Mondays we've had in a while. We're announcing only 90 new cases of COVID-19. One of the first times, at least in a little while, that we have been under triple digits. With those 90 new cases, our total cases are 13,839. Now 13,449 are lab confirmed, 390 are probable. As of today, we've tested over 352,215 Kentuckians. That is, again, something that I am extremely grateful for the work of so many to get us from a place where there wasn't a test that existed for this virus to now having the testing capacity to reopen safely. We just got to make sure we continue to go out and to get tested. Total number of Kentuckians ever hospitalized, 2,532, currently 349. Ever in the ICU, 987, currently 67, remaining really low. Total number recovered, 3,534. Right now, our hospital occupancy, our total beds, only about 50%, so we have a lot of room there. And ICU occupancy is about 70%, still a lot of room there in case we do see a spike. Number of cases today by county, 27 in Jefferson, 5 in Campbell and McCracken, 4 in Fayette, Shelby and Warren, 3 in Boone, Franklin, Kenton, Washington, 2 in Boyle, Callaway, Christian, Clark, Graves, Lincoln, Marion, Marshall, and Perry, and 1 in Bullitt, Davis, Fulton, Greenup, Jessamine, Johnson, Leslie, Madison, Nelson, Trigg, and Whitley. Here's the best news of the day. We are reporting no new deaths today for COVID-19. At least in the last 2 months, I only remember 2 of these days. And for somebody who has read genders and ages and counties, knowing that each one of them is a loss of now 526 Kentuckians, to have no reportable deaths today is special. And we're very grateful and blessed that at least for a day there is a reprieve from a virus that is aggressive and can be deadly. The racial and ethnic breakdown on total cases, 73.22% white, 15.08% black, 6.39% multiracial, 4.63% Asian. Ethnicity, 83.2% non-Hispanic, 16.8% Hispanic. On deaths, 79.92% white, 16.63% black, 1.83% multiracial, 1.62% Asian. And on ethnicity, about 95.76% non-Hispanic and 4.24% Hispanic. Again, this virus has shown us what inequality in healthcare, especially over generations, can do, it results in death. Our commitment is to absolutely fix it going forward. Given both our numbers for the last week and some of the reopenings now, with just about everything reopen at some level and others stepping up, I wanted to give Dr. Stack a chance to talk about where he thinks we are and some of the guidance that will be up online today, which gives everybody at least a week to prepare for their opening. Steve?
Thank you very much, Governor Beshear, and good afternoon, everyone. So 3 things to talk about. The first is the guidance that will be posted today. It may be on the website while we were talking here. We will have guidance for gatherings up to 50 people. We will also have gatherings for professionally organized venues and event spaces. So you can think when I talk about that for hotels and arenas and other events that are generally professionally done. And then also restaurants and bars. So there's guidance on the website already for restaurants where they could operate up to 33%. All of these guidances will go into effect for Monday, June 29th. When they go into effect for restaurants and bars, that new restaurant and bar document will supersede the previous one. So restaurants and bars could operate up to 50% as long as, and there's requirements in the document, they can maintain social distancing greater than 6 feet and they can comply with the other requirements. That's good news. People will have the opportunity to expand. Please do it responsibly. This is our phase 3. June 29 marks the beginning of phase 3 as described in President Trump's Opening Up America Again plan. These plans all require the steps you should all be well familiar with right now. You need to socially distance more than 6 feet from each other if you are not from the same family household or same household. The governor also added a really good rule of thumb to remember. If you're operating a business or an establishment, operate at 50% of what your pre-corona capacity was. That will help you to reduce the density and get much closer to that 6 feet distance mark. Mask or cloth face coverings are absolutely essential. I get to do phone calls on a regular basis with my fellow state health officials from around the United States. And I think almost to a T, every one of us is universally frustrated, challenged, at times despondent at how many individuals, for whatever reason, are choosing not to comply with the face covering guidance. This is a big deal. These little things are cheap, they're simple, and they make a big difference. And so either to keep yourself safe or someone you care about or love, or to keep others safe, please use cloth face coverings whenever you are near other people. It is simple and it can help us to be able to keep things open if we comply. Hand and surface hygiene, please wash your hands often, use hand sanitizer often, certainly anytime you touch or come in contact with objects that other people may use. And also fever and coronavirus symptom screening. Please, every single day, check your temperature. If you have symptoms of fever, cough, loss of smell or taste, vomiting or diarrhea, shortness of breath, if you have those sorts of symptoms, stay home, arrange for a test, get the test, and then stay home until you get the result. These are the steps we have to take to keep ourselves safe. I want to thank, as I make this third point, thank the governor. The governor has been supportive this entire emergency response and encouraging me to be able to share the science and the medicine as I understand it and try to give you straight talking advice. This is a dangerous disease, and we are seeing in other states dramatic surges. And I showed last Monday these surges. And in Arizona, it's a vertical climb. And when I talk to people in some of these other states who are in similar positions of responsibility, they have concerns about what they're seeing. It's not just about testing more. It's about also hospitals seeing more patients positive for coronavirus who are needing medical care, and hospitals getting an increased number of patients in the hospital for COVID-19. I don't see what we're doing as inconsistent. I see what we're doing as important because society has to return to some of its activities. We've acknowledged that all along. But we can only stay open, we can only return to these activities if people follow these simple steps we've asked. They're simple steps that are not always simple to execute because they really change the world as we know them. But these are the things we have to do until we get a vaccine or a treatment. So I really, really please ask you, because right now the governor's announcing for us really good numbers. I mean, we have good numbers recently, which enables us to responsibly attempt to go to phase 3 on June 29th. Whether we can stay at phase 3 or stay there responsibly depends on what you do back at home and what you do when you're out in public. So please, wear these face coverings and stay 6 feet away from people you don't live with whenever possible. And if we do these things and we work together, and if we participate in the contact tracing, hopefully we can stay open and help Kentucky build back better and come back to maybe a slightly different but a better future going forward. So thank you very much, and thank you, Governor.
James, let's show the long-term care numbers. As we've seen, long-term care is one of the most concerning areas. It's where in every state this virus is the most deadly. Since our last update, we've had 65 additional residents and 9 additional staff test positive for the virus. 1 additional death has been attributed. Now, I will say, when you look at the low numbers we've been reporting, we have been involved in a massive testing of all of our nursing homes, which is where we'd be worried the most. And to have low numbers testing in an area where it would spread very easily is also a positive sign that while these numbers are tough, they are stabilizing. Now, there is 1 positive case at Eastern Kentucky Veterans Center. The whole facility is being tested tomorrow by the Norton Gravity team. So, good numbers the last week, but here's how quickly things can go south. Arizona was having good numbers too. They're about 1.5 times the size of Kentucky. And in just 3 days last week, if you combine just 3 days, we've been at this months, since March 6th. In just 3 days last week, they had over 7,000 cases. Right now, we're under 14,000 total cases. In 3 days, they racked up half the total number that Kentucky has had since the very start. So it's just really important as we move forward that we continue to do the best we can to follow these rules. I know summer's here, and I know that it can be real easy to want to not do all the things that we need folks to do. All right, let's look real quickly at our primary election. While I would say it is coming up tomorrow, it has in fact been going on in Kentucky for about a month. One of the things that I did as governor is called up the National Guard to support any county and any number of their polling centers to make sure that we weren't putting the most vulnerable, which are typically our poll workers, at risk. I know Rachel will be back in a minute. I think she needs just a little bit of water. That's okay. There's no air conditioning in here, folks, and so I'll talk just a little bit until she gets back. These are the counties that we are currently helping in. We want to thank our National Guard. Remember, they're our friends, our family members, our neighbors until they are called up to service at different times. Their training makes them uniquely qualified to do this and to do it in a safe way. Also want to give you a brief update on the numbers leading into tomorrow as we know them. Right? Okay, so thus far we have had, remember, that between the Secretary of State and my office, we made an agreement which basically allowed mail-in voting for the first time in Kentucky's history. It's something that is believed to be one of the major steps towards significantly increasing voting. Here, it's no excuse absentee voting. Sure, there are some extra steps that could be taken, but because of that step, 883,054 ballots were requested. To give you an idea just how that compares, and this is just people that are going to do it through the mail, 200,000 more than voted in my primary or Governor Bevins combined last year. More than in 2016, where we had our last presidential election. Now, this is comparing just the absentee ballots to the total number of people that voted in those last elections. And as we look back all the way to 2016, If all the absentee ballots are returned, we will have the largest number of people voting in one of our primaries in at least the last decade. But that's not the only thing. So what's been allowed in Kentucky for the very first time is mail-in voting. The second thing that's been allowed is no excuse early voting. We've been a state where you have to fill out an affidavit if you want to vote early. That has not been the case in this election, and we've already had over 88,530 Kentuckians vote. And then from that mail-in absentee, this is just up to yesterday, we've already had 452,305 returned. Remember, as long as they are postmarked by tomorrow, they must be counted. So I believe that we are on our way in this state to have potentially a record number of votes in our primary, and that's important. I know that there are concerns about numbers of polling places in different locations. We should always be concerned if we think more people could vote in a different way. But what I'd ask is that people look at all of the facts, including first ever mail-in voting, first ever no excuse early voting, and the numbers are already adding up to be the most significant primary in terms of voter interest and in votes that we have seen. Now, I know that there's been some specific interest in Jefferson County, so let's look at the numbers there. In 2019, again, a primary I was very interested in because I was in it. 133,405 folks voted in Jefferson County. Already 80+ thousand more have requested absentee ballots, of which 102,000 have already come in, with 7,200 people voting early. Again, our expectation is we will see the largest primary vote in Jefferson County that we have, at least going back probably a decade or more. But everybody, vote. If that absentee ballot has come in and you haven't filled it out, it's got to be postmarked tomorrow, vote. If it hasn't come in, you can go to the polling location and vote. There is still a little bit of time, I believe, today that most of those polling locations are open. You can go vote early. And tomorrow, if you haven't done any of those things, go and vote. I know in different areas around the state, they're trying to do everything they can to get you in and out faster. I believe that can happen. Just make sure that we do what it looks like we're going to do. Have the single largest vote in a primary, at least that we have seen in over a decade. Last, a quick update on unemployment. First, let's start about where we've been. We talked about that the other day. The challenge we face is a deluge of claims, but it's also what infrastructure was there at the start of this to manage those claims. And what we've learned basically is a couple of things. Number one, if you design a system to tell people no, even if they should get unemployment, because a whole lot of people were told no before this, and then you starve that system consistently over and over and over, you're unprepared from an infrastructure standpoint for something like we're seeing right now, which is a record number of claims. So the challenges we face right now, and we won't solve any of them overnight, but we're working hard on them, is first a computer system that is 20 years old, that was installed the year I graduated from college, and I remember I got my first email address when I went to college. So within 4 years of that time frame, it shows you how old and how difficult that system is. Then we dealt with a system of changes, especially in 2017, that have been incredibly difficult. Number one, a loss of 30 offices out in the state that would have helped with unemployment. The loss of 95 employees that worked on unemployment, but even worse than that, at that point, in-person unemployment appointments were generally canceled, and instead a call center of 12 people were put together to answer all of the questions out there. The budget was cut from $41 million to $25 million, and that's where we were in December when I came in. We'd made a few changes, including putting 12 people out into facilities, but with now nearly 1 million unemployment claims filed, we are in a place where we are working fast and hard to not just process as many claims as we can, but to rebuild the infrastructure. Because right now, or at least with what we were facing, the infrastructure didn't exist to be able to process that number of claims in a timely manner. But we've learned. We have now processed over 90% of the March, April, and May claims that have come in, which is a lot better than other states. But when you have almost 1 million claims filed, that still leaves a ton of people that need help. And so we're continuing to take steps and to make changes. So last week we were able to have our first in-person ability for people to come in. And I got to tell you, it helped. Those that came through were able to get help. What happened most often is somebody had checked a wrong box in filling out their application. And because the system was set up to tell you no, they never got a pop-up on the software when they checked it saying this will mean that you're not able. And fixing it is incredibly difficult, both in the system itself and with the lack of the number of people that we need, but we are going to fix to make sure that we can address those concerns. So 3 things today. Number 1, I told you I was reorganizing the unemployment office to move it over to the Labor Cabinet. Today, our Labor Cabinet Secretary Larry Roberts is stepping in directly as the Commissioner of Unemployment Insurance. It's going to mean that the entire Cabinet is working on it day in and day out, and that the head of that Cabinet is working daily on these claims. I believe it is something that is going to hopefully speed things up. I believe that it's going to add some extra efficiencies, and I want to make sure that things are getting done and that things are getting better. Number 2, we are finalizing a contract with an outside vendor to be able to help us in processing, in communications, where we have needed to do so much better, and also in training. We got to get a whole lot of new, what we call adjudicators, people that can call you and get that claim sorted out. We got to get them done fast. And so having outside help is going to speed that process up, and I'm not willing to wait any longer for us to be able to do it internally. We've had long enough. If it takes outside help, and it does, people that know what they're doing, that have worked in this area forever, that have come in and fixed systems and that are working in other states, that's exactly what I want. I'll pay whatever it takes to get this thing fixed. And last, near the end of the week, we hope to have some additional in-person services. And I hope by next week, we will be out in the state in different areas. But I do want to continue to tell people that I wish tomorrow we could have every claim resolved. We still have the same system. We're still working to overcome the budget slash. We're still working to overcome the lack of employees as we train and as we add. Unfortunately, that takes time, and it's time many of you all don't have. I should also note, because Rocky Atkins, who's my senior advisor, told me when these changes happened in 2017, he filed a bill to stop them, to stop the cuts, to stop the consolidation of offices, and that bill never got a hearing. But this issue was in front of the House of Representatives in 2017. Now, that's the past. Just because it explains where we are right now doesn't mean that I don't have a duty to fix it, and I'm going to. I'm going to. I wanted to be a governor that helped people, and I know a lot of people out there still need help and are frustrated, so we're going to fix it. But what I hope is that we have bipartisan support throughout every branch of government to make sure that this doesn't happen again, and we have the type of investment in a state budget with support from every branch to make sure that we never starve this safety net again, not just now, but if this happens again 100 years from now, shame on us if we haven't fixed it. All right, we'll move into questions because it is warm in here, and I know it is a beautiful day outside. I have just a few here, and we have a number of reporters with us today. Why don't we start with Phil?
You know, like how many in-person places you might be able to have across the state of Kentucky next week?
So the question is, how many places across Kentucky will we likely be able to have next week, given how much the office was starved and the number of people that are trained to be adjudicators, and what we need to continue to do in the office? Because not everybody with the oldest claim is going to be able to come to a place, and we still need to be helping them. It's likely that we will have probably 2 to 3 at the beginning of next week. And again, still in the planning stages. My hope is that regionally we can get up to 4 to 5 to where everybody could be within a certain distance. What we're doing right now is we saw everybody who stood in line way too long on Friday and didn't get help. They all had an appointment today, and I think we're through them. Tuesday and at least Wednesday, we want to make sure we reach out to everybody who drove up those days next week and didn't get help. And I know those lines, ended up making national news. And it struck me, the first day, everybody said, oh, this is a great idea. And, well, it's not what the idea is. It was necessary to help people. But you know what it did? It put a face on it. But it's not just a face on what's going on in Kentucky. It's a face on what's going on around the country and the pain that people are in. And while, it may have been used in ways that make Kentucky or me look bad, a face on people's pain and suffering is important. It's important for everybody out there to know how much people are hurting. And I hope it helps both this administration and others get the support that they need to make sure it doesn't happen again. Karen.
Have you, talking about the lines last week, is it possible or have you considered having some sort of sign-up portal like it has been?
So the question is about having a sign-up portal if we do when we do further in person. That's one of our challenges, and that's what we need some of the outside help with. When you're working with such an old system, I got to tell you, I've asked for give me the 100 oldest claims, and I can't get them. I can't tell you with this system how many things I've asked for being the governor of the Commonwealth of Kentucky that has been incredibly difficult to get. And so one of the things that I hope the outside help will get us is ensuring that we can create a priority system that's not just people standing in line. And yes, we ought to do it by appointments so nobody is frustrated out there, but I also understand that if you really need it, you're willing to show up and to stand in line, then we need to honor that too. But yes, we need better ways to do it, and all of those don't have to be in person as opposed to face, with all the ability from FaceTime to Zoom. What's most important to me is people know when they're going to get a call or see somebody in person, and they're ready, they have all the documents they need, and we fix it right then and there. All right, Churchill Downs submitted its plan for the Kentucky Derby. What's the status of the plan? I think we're close. We've gone back and forth once. I envision a Derby that is different than the Belmont, which we saw, but I want to wait until that plan is final. I believe that Churchill Downs made a very good decision in moving the race. It certainly wouldn't have been safe when it was. I think that they are offering a lot of concessions and looking at safety precautions, so I hope to have some information on that even this week. I'm reaching out to confirm that part of the new election rules under Governor Beshear's executive order allowed for Kentucky counties, regardless of population, to open a minimum of 1 polling site. My orders didn't specify a number of polling sites at all. It allowed the Board of Elections to issue regulations on how that would work. Lawrence.
Does the low numbers we're seeing kind of indicate this slower reopening schedule that you put out earlier, some of the steps you've taken along with that? And the spikes we're seeing elsewhere in the country, does that concern you going forward with reopening?
The two-part question, that's how you put 2 questions into one, is first, do I believe the low numbers vindicate how we've done our reopening? And I think the question was slow reopening. I believe we're right in the middle in where the country is. You see a whole lot of states right now that are just allowing takeout services from restaurants. We've allowed those the whole time. You just now see some states offering curbside retail pickup, and we've allowed that the whole time. I believe that we haven't been the very fastest. Those are your Texases, your Floridas, your South Carolinas. We certainly haven't been the slowest. My goal is to be the smartest, and right now, the numbers appear to support that opening plan. But I want to be humble about this virus. It can pop up real fast. It can potentially be unpredictable. So while right now I believe it supports what we've done, I don't want to sit on laurels. I'm not going to declare victory until there's a vaccine. But I believe 2 things have us where we are today. Number one is pacing it correctly, allowing people to ease into it, just like when we eased into restrictions. And the second is people following the rules, at least to a degree. I have some concern as the summer wears on that fewer people are going to follow them. I'm not seeing nearly the amount of masks we need to. You have countries out there that are doing an amazing job simply because they're willing to wear masks. And so I am concerned going forward that if we don't follow these rules to the best of our ability, then we'll certainly see an increase. Will we see a spike like others have had? I don't think necessarily. And right now we're seeing some cases that appear to be coming back from other states. We're seeing at least a couple cases, a couple clusters from people who went to a beach in another state and came back, and multiple people have tested positive. Catherine.
Mail-in ballots. Do you have any concerns though with how we may see a situation like in Georgia or Wisconsin, people are stuck waiting in line all day with fear?
So the question is, I talked about the mail-in ballots. Do I have concerns that we will see long lines tomorrow at the polling locations? If everybody that has a mail-in ballot sends it back in, right, fills it out, postmarks it by tomorrow, and believes that it'll be counted, because it will, I don't think we will see lines like we saw in Georgia. If people do not, if they have one but they've decided they're going to vote in person, then we will see longer lines. So I'm pleading with people that if you have one, it's the easiest it'll ever be to vote, mail it in, you'll have done your duty, it'll count. It'll count. Results aren't going to come out, to my knowledge, on the day anybody votes in person any faster than they're going to come out of the absentee. I believe that the county we would worry about it the most is Jefferson County. They've allowed early voting for almost a week. Now, it hadn't been taken advantage of in the way that I would have hoped, and if we ever get a chance to do early voting again, I hope a lot more people come out earlier. I do believe they've got a big setup at one of the largest places, and so my hope is that we don't see those lines. Now, if we do, it's because people are showing up to vote in numbers that we've never seen, and we will have a significantly higher primary vote count than we've ever seen. If so, wear a mask, spread out, get that vote counted, but do it safely. But I will say that yes, I mean, everybody would like to have more than one polling location in an area. I get that, and I think it's a valid criticism. But I think you got to add in first time ever in mail-in voting, first time ever in no excuse early voting. Since an executive order I signed 3 days into office, 170,000 plus people with the right to vote that otherwise wouldn't have had it. Morgan.
The census for some people so they can get out of getting incarcerated because of the virus. Of those, the Department of Corrections released 199 people into the custody of a law enforcement agency. Does that kind of speak or emulate how purpose what you were doing, and that they're being released not home but into another form of custody?
So the question is, of some folks we released from prison early because of the COVID virus, and remember they had to satisfy a couple of things. Number one, non-sexual, non-violent crime. They have to have been very close to finishing their sentence, or they had to be within 5 years of finishing their sentence and be medically fragile. Some of those individuals were turned over to other law enforcement units because they also have convictions, oftentimes from other states and other areas. And so while I can commute a Kentucky sentence, I can't commute them in other places. There are also some that still had charges pending. Does it frustrate the intent of what we were doing? Only if they come back to a Kentucky facility and are still in that Kentucky facility, then that does create a problem. But while I can do a number of things as governor, there are certain limitations, especially with other states that under the law I can't address. Phil?
Based on that 50% capacity, would you possibly see in like Rubber Arena, the Young Center, even sporting events at 50% capacity late this summer or early next fall?
Can I see sporting events at 50% capacity this summer or early fall? Indoor events, that would be a challenge. But I can see, again, if you can socially distance, if you can get 6 feet from a family unit in each direction, if people will wear masks, because at a sporting event, when you're standing up and you're rooting for your team, you could spread the virus like that, then I certainly can see the opportunity for fans in the fall. When you move to an outdoor sport, we believe it's a little bit safer. Again, you have to make sure that you have the distancing. Another thing that we need in all of these, and it's something Kentucky Kingdom is doing, for example, and they were very innovative at doing this. It's going to make going there safer, is to have a phone number attached to every ticket. And what that does, if you know where everybody's sitting or when they've been there and the ability to contact them, if we do have a COVID outbreak, then we're able to contact trace people who are at a very large event. And so if we're going to have these things with larger events, we have to be able to provide direct notifications to those who were there. I think that the organizations themselves, the conferences and the rest are going to have to also look at what they're doing. And we got to look at the fact that when we deal with student athletes, we just got to make sure it's safe. It was a shock when, was it 22 Clemson football players tested positive? So we're going to have to make sure that it is safe for the student athletes and the fans, but I can see us certainly moving in that direction.
So would you call this now still a plateau or a decline, and the president's believes we're over-testing? Your reaction? Not
we are not over-testing. We can't test enough. The more we test, the more we can contact trace. If we could test everybody in the Commonwealth of Kentucky today, we could prevent the spread of this virus, at least with regards to people in Kentucky, significantly. There may be some that wouldn't register on the test just yet, but the more you test, the more you can do to mitigate the virus. We want more testing even than we have right now. And if everybody in the Commonwealth were willing to get tested every 2 weeks, there's almost no limit to what we could do in terms of reopening and how safely we could do it. What was the first part of the question?
Are you calling us still a plateau?
Yeah, I think we are still in a plateau. And remember, I made sure that we were in a decline before when we could look at 2 weeks. What we've seen is we'll see, at the highest 300 and something positives, and at the lowest, on a non-Sunday, about 120. There's kind of bouncing back and forth there. Remember, a plateau won't be the same number, but it'll be when you graph it out on an average. It'll be. I think we are still at a plateau. We may be fortunate to stay at a plateau with the additional contacts that we have, especially with everything else we're reopening, because every time we do an additional reopening, people are going to have more contacts with other people. We're going from 10 to 50 people. If we can stay plateaued, that means we're managing the virus and having 50% of our hospital beds open, 30% of our ICUs, most of our ventilators are all positive signs. Lawrence.
Thoughts on the founder of Brady Industries getting $6 million to essentially go away, drop this lawsuit, and there's still no limit.
Now, there's a question on Brady announcement that the former CEO was paid $6 million to settle that lawsuit. I don't have the details of that payment yet, but we need to look very carefully at where that project is and the state's investment. Our state is either going to have a finished aluminum mill that creates the jobs that are being promised, and that's the outcome that we would all prefer, or we're going to get our money back. Now, I'm going to make sure that one of those two things happens. Let me read one here. Working on a report about restaurants in Kentucky now being able to open to 50% capacity. Want to verify how COVID-19 guidelines like this are enforced among restaurants. Are they guidelines given to restaurants to incorporate as they choose? Are there penalties for not following the guidelines? The guidelines are mandatory in part. They are also guidance in other parts, must versus should and shall. Restaurants that do not follow it when they are inspected in any number of ways, yes, could be shut down, but what's more likely to happen is you're likely to have people that test positive and then it spreads in the restaurant, and that's going to shut you down for a lot longer. But I will say, restaurants we're seeing around the Commonwealth, I think, are doing a great job. The way that folks have communicated with changes they want to see in the office has also been generally a positive discussion. We've learned a lot more about the industry, and we appreciate that. But I think that most restaurant owners out there want it to be a safe place and understand the ramifications if this thing spreads. Catherine? The question is about visitation of inmates. As we move forward, that's a question we're going to be able to look at. Now, it would only be as we look at an opportunity to do it in stabilized facilities, certainly not in any area where there's been an outbreak. And as we look at the ability to do it, we would have certain requirements of health checks and many other things. We need to get back to a point where we can do it, but knowing that we have had 2 outbreaks and how severe they can be, we need to be really careful about it. Certainly, the federal prison in Fayette County, and I don't mean to laugh because it's a very serious situation that happened there, shows you, I think, how well comparatively we've managed state facilities, but because of the nature of a prison, one case can very quickly proliferate into so many. So I want inmates to be able to see their family, but I want them to not get COVID even more. Morgan.
Over the weekend, there's been a lot of chatter on social media, including some kind of national celebrities talking about voters, how they think that there's voter suppression happening here in the state because of the reduction in polling places. Do you have a response to that?
We have more people that have requested absentee ballots than voted in any of the primary elections in the past, at least 5 years that we had up there. We've had mail-in voting for the first time in our history. I think that's the opposite of voter suppression. We've had no excuse early voting for the first time in our history. I think that's the opposite of voter suppression. We've had 170,000 people have their voting rights restored, which is, I think, the opposite of voter suppression. Now, that doesn't fit in Twitter very easily, and I get that. And yes, there can be concerns about one polling location, though I don't think it's being done intentionally to suppress the vote. But at the end of the day, I believe we're going to have more people vote in this primary than I've ever seen. I think we're going to have our largest turnout. Now, should we learn some lessons in both what we've heard and what we'll see tomorrow for November's election? Absolutely. Now, let me say this. I do want there to be the no excuse absentee voting option in November. That's a positive thing. I want there to be early voting for November. That's a positive thing. But especially if we see really long lines tomorrow, or if we see people that didn't vote that otherwise would have voted if there were more locations, then that's something that we're going to have to address. But I also want to make sure that we remember that COVID does have an impact. If you ignore an international health pandemic, then I guess things are simpler. But we also got to remember the poll workers that we have and how susceptible they might be to this virus. But we're going to have numbers a week from tomorrow about the total number of people who have voted, and if it's higher than ever before, I hope that it's not me, it's the Board of Elections, the Secretary of State, and others, that people acknowledge that too. But I will remind you that I didn't have any control on the number of polling locations that are out there. I just want to see as many people vote as possible. And if you had a mailing address this time and you got the information, it was easier than ever, but that doesn't mean that to some, it may be harder than it should be. All right, we will be back here on Wednesday. My hope is with 2 more days of lower COVID numbers, and on Wednesday, we're going to talk about our Healthy at School proposals. And I just want to prepare everybody. We're going to be able to go back to in-person classes, at least part of a week. I hope all of the week. But it's got to look different. Now, if we say that it should be the same and we can't do all these things that we're asking people to do in the rest of their lives, we're not going to be able to tell you it's safe for kids to be all together in the middle of COVID, especially for parents and grandparents that are taking care of them that may be compromised for this virus. So I need people to keep an open mind and to understand when we come out with this guidance, it's to protect our children. I'm the dad of a 9 and a 10-year-old. My 10-year-old is going to start public school here in Frankfort under our plan this year. So I'm going to go about this like not just a governor, but any parent would do to provide the best possible guidance to keep your kids safe. Thank you very much.